So let's talk about types. There's lots and lots of brands of knee replacement, but in general they all boil down to one of two different types. There's partial knee replacements, which I think most of you have heard of, or total knee replacements. Partial knee replacements, as the name suggests, involves replacing just the part of the knee that's worn, whereas a total knee replacement is performing a replacement of the entire knee joint. And then there's techniques. You know, we, for many, many years, since the 70s, have relied on instruments, or jigs, if you will, that help us as surgeons size and align the components properly during surgery. You know, everybody's knee is a little bit different, but we have to get the implant in straight, we have to get it in properly rotated, and we have to put in the correct size, or else the ligaments and the muscles and the tendons that surround the knee won't balance properly and it won't feel right. But the evolution in these implantation techniques over the last several years has included the use of computers to assist us in these different alignment and rotation and sizing decisions that we make. So we can use computers both before surgery, which we do commonly now, and I'll explain that in a minute. We can use computers during surgery while we're actually implanting the device, or we can do both. And I'll talk to you about what I commonly do now and routinely do, and the reasons that I do that. So here we go. We're talking back now about types of knee replacement. The picture on the left, as you can see, has less metal, which is the white stuff here, than the picture on the right. So this picture on the left is a photograph of an X-ray of a partial knee replacement, and you can see that the inner part of the knee on the femur, which is the end of the thigh bone, and the upper part of the tibia has been replaced with a knee replacement part, but that the rest of the knee, the outer side of the knee, has been untouched. And sort of take a mental picture of that and contrast it to this total knee replacement X-ray, where the entire femur or the entire end of the thigh bone has been replaced, as has the upper end of the tibia bone. And I think you can see very clearly that there's got to be some, pretty significant differences in how these implants work and how they're implanted. So let's talk just briefly about the knee. We as surgeons typically divide the knee into three compartments. We have what's called the medial compartment, which is the inside part of your knee, where the knees touch one another as you're sitting still. We have the lateral compartment, which is the outside part of the knee, out towards the outside part of your body. And then we have what's called the anterior compartment, or the patellofemoral compartment, which is where your kneecap sits. And so if we're going to choose to do a partial knee replacement, we can replace this part, or we can replace that part, or we can replace the part behind the kneecap. Whereas if we do a total knee replacement, we replace the whole thing. This is what a total knee replacement looks like. This is fairly common for most of the major manufacturers of knee implants that currently sell these in North America. The implants are almost universally made out of metal. The metal is shiny. It's a cobalt chromium alloy is what most of the companies use now. So you've got cobalt chrome metal up above, which caps the end of the thigh bone. You've got some cobalt chrome metal down below, which goes into the shin bone or the tibia. And then you've got a piece of high molecular weight medical grade plastic or polyethylene that goes in between. And so if you remember back about 10 or 15 slides when I showed you the cartoon of the arthritic knee with the little pock marks and the divots in it, we're taking those roughened surfaces and placing instead a cap, if you will, on the end of the bone that's perfectly smooth and polished and made of metal. And that cap is going to move against or articulate with this polished, high density, high molecular weight piece of plastic. And that's what makes the knee feel smooth again and feel normal. So I'm sorry if this is too graphic for some of you, but it's important, I think, to know what a total knee is. I mean, this is a little bit of an exaggerated photo because this is sort of an older technique of implanting one of these devices, but what it involves is actually opening the knee with an incision, sometimes 8 or 10 or even 12 inches long, moving the muscles and tendons out of the way, and then using different instruments like the one you see in the lower left-hand corner and the lower right-hand corner to align the devices, and then using actually power saws and drills to prepare the bone in a way that will accept the new component. So that doesn't sound like a lot of fun. So and so this is what it looks like in a cartoon graphic. When you take a knee and look at it from the side, in order to implant the prosthesis or the new knee replacement, you have to remove segments of bone in order to fit on the metal pieces that are designed to cover the ends of the bone. And there's no way to really do that without removing segments of bone. And so most of the modern knee implants involve typically about 5 cuts, 1, 2, 3, 4, 5, to take what was sort of a roundish looking bone and turn it into a multifaceted bone that we can then cement the new prosthesis into place. That's what it looks like once it's implanted. So total knee replacements work well, but what if this is your problem? This is a picture of an X-ray of a patient who has pain on the inner part of the knee, the medial compartment where the bones touch one another, and you can see that there's something missing, right? There's no space between the bones, which indicates that the cartilage that covers the bones has completely worn out and worn thin. But look at the outer side of the knee, a nice wide space, meaning normal cartilage. So this particular individual has arthritis due to the fact that the cartilage has deteriorated in one part of the knee, but not the other parts. So it would seem a shame, maybe, to have to replace the whole entire knee if only a part of the knee is worn. So here are a few things that we know about partial knee replacements. There are a number of acceptable products. There's about 5 or 6 major manufacturers of these implants in the world, most of them based in North America. And the decision on which of these implants to use is dependent on both the physician and the patient. And there's not a wrong answer. There are many, many good implants out there which can solve this problem of arthritis involving just part of the knee.